common injuries and first aid tips. Now this topic basically I've brought to you for all the classes. That is, what is first aid? Many times we get afraid if when anybody gets hurt, and we run round and round instead of understanding the situation and solving that problem. So here I brought you 6 common injuries and its first aid tips. Kids keep running around and exploring their surroundings, making them prone to getting hurt. Now, prone yani ki getting used to getting hurt. They just run around, they slip, they fall, they get hurt, right? So, first aid for children is essential and can save lives in serious situations. Now, for example, even a minor injury also can cause somebody's life. So, for this, first aid is very necessary. So, here let's talk about the 6 major tips on getting first aid which can help out people. First one, cuts and scrapes. Now, if it's a cut, little more care has to be taken. But if it's a scrape, like the image over here, okay, how it has to be treated. Now, how you get scrapes, right? What you have to understand the difference between cuts and scrapes. Now, how you get a scrape? Scrapes are when you are playing around or running around and you slip and you fall and you get a bruise on your leg, like a redness comes on the leg and little bit blood. You can see small patches of red blood patches or something. That is a scrape. A cut is anything where the skin is open out fully and you have a deep wound where you can see excess bleeding. If it's a cut, you have excess bleeding, so you have to take care of that. But if it's a scrape like this image, then how you have to deal with it, I will show it to you. What to do right away, right? Now, very first thing is you have to arrest the bleeding by applying pressure to a cut of the area. Now, if it's a scrape or a cut, what you have to do is you have to press the area with some cloth or something so that it can stop the bleeding. See, by pressing a wound, okay, 90% of the bleeding reduces as you're giving pressure to that place, and the vessel whichever is cut, the wounds whichever open, that intends to stop the bleeding as you're blocking the blood flow. So that's the very first thing. What you have to do is press the wound tightly so that it can reduce the bleeding or stop the bleeding rather. Very first thing is running your hand under warm water and flowing water, okay? It has to be flowing water mixed with antiseptic liquid. Now, antiseptic liquid, you have Dettol, Savlon. These are all antiseptic liquids which can be used in this warm water, right? And remember, the water can be lukewarm, not warm, matlab not hot, lukewarm, okay? And sanitize and you have to clean the area out. Now, why clean the area out? Because when you have fallen down or anything, if any germs is there, it can get to the wound. So, by cleaning your hand in this manner, you are protecting the area from getting any infection. Then, the wound has to be cleaned with warm water, as I said, mixed with antiseptic liquid, sanitize, clean the area. Apply an antiseptic cream, cover the wound with a loose bandage. Very important thing. Why you have to cover a wound with a loose bandage is air has to be also flowing in it. At the same time, no flies or any germs should sit on that wound. And of course, antiseptic, as in case any bacteria or anything is in the wound or got to the wound where you are not able to clean, the antiseptic will destroy it and clean it out, right? So, in short, you have to understand this by cleaning your wound with antiseptic. And very first thing is using a mixture of antiseptic liquids like Dettol, like I said, and then after that use antiseptic cream to cover it. So, following up, the child has to go to the hospital for a tetanus, as it's an injury created by the ground or anything. So, tetanus is very necessary. Okay. Now, of course, a tetanus can be given in the last 10 days of the year. Change the bandage every day until the wound heals. Now, you cannot keep the same bandage right through. The bandage has to be changed on a regular basis so that you are even getting a vision of the wound, whether it's healing. In the same time, you are putting fresh medicine. What to do right away? Now, this is for the minor burns. Immediately put the burn under cool running water for approximately 5 minutes. By putting your hand under cold water or cool water rather and letting it flow, it reduces the burning sensation on the outer surface, and it does not allow the skin to get contaminated with the heat, and it cools the skin down so that the burn reduces. So simply just put your hand under running water immediately after the burn so that it reduces the burning sensation and any problem. Now, very important in this minor burns is you should never use ice. They say rub ice. No, avoid rubbing ice over the affected area as it stops blood circulation, and the region affected will not heal. Right? In fact, it will affect the area more. So never use ice when you get a burn, as it can cause more trouble. Avoid using any grease or other substances which cover the burn, as it traps heat and delays healing. So never use any oily substances or never use ice on your wound, as it stops the healing process. What happens, it simply coats the area, so if any heat is trapped inside the skin, it will not escape, and that causes the burn to get blisters and other problems. Now, following up with this mild burns is the child will feel lots of pain during this treatment until the burn heals. If the pain is unbearable, the child should be taken, or you should go to a doctor immediately to see if any further damage has taken place in the infected area.